So if that's okay, maybe shall we resume? Yep. So quick reminder of what the afternoon looks like until 4:15. So half an hour to go over a roadmap to build strategies, advocacy strategies. So these are suggestions and tips. Then with that methodology and the knowledge you have, you work individually on the pack, the slide deck, sorry, that was sent to you yesterday. They will have a coffee break. You can use it for coffee or finish your individual work, either way. We meet again at 2:30 and in 3 separate groups. So each of you will be allocated to your indicator working group and to discuss challenges in your country, identify opportunities for advocacy based on the report, and suggested advocacy strategy or advocacy methodology. You prepare an elevator pitch. So, to sort of wrap up, you prepare an elevator pitch and present to the plenary from 3:10 to 3:40. So it's 10 minutes for each group. And then we'll have time for questions and closing remarks. So the following are suggested tools and tips to start sort of structuring, building your advocacy strategies. The objective, you've got all this insight, but then how do you transform this insight into action? How do you make sure that the knowledge, and we discussed this morning, is evolving? The report, the benchmarking report has some value as it is. This is a snapshot at one time, has some value, and some updates seems to be needed at some point. But how can you use what's in this report and transform this into advocacy strategies? So I'll go back to Marie-Christine's point this morning, which is true in the sense of there are things that you can do, but you have to collaborate with others. So the calls to action are objectives you would like all stakeholders to contribute to. So you contribute to it, but you're not the only one. You can't be the only one. You have to partner with other stakeholders. But then the advocacy activities are the initiatives that you undertake to contribute to calls to action. So for the purpose of this presentation and for our discussion, this is the difference between call to action and advocacy activities. So there are overarching questions to ask oneself before planning any advocacy activities. This is kind of unstructured thinking with, just sort of which stakeholders will bring about the change that you're aiming for, the ones that are the real decision makers, the ones that have the direct power. And you've got those that influence those stakeholders that have the decision-making power. So how will this change be achieved? Do we need to pass a legislation, a bill? Do we need to update guidelines? What is it that needs to be done? A petition, a call for a referendum, all these different type of activities. And when would you like it to be achieved? It's good to have some time frame in your mind of when overall, like some milestones will be achieved potentially. Obviously, it should be flexible, but having some time frame really helps focusing your energy and effort. So here on this slide is a roadmap to building an advocacy strategy. And these different steps are adapted actually from a patient organization called Myeloma Patient Europe. They have a coaching program, which is actually quite interesting if you want to have a look at it. Essentially, the steps are the following. You want to prioritize your calls to action. And then you do stakeholder mapping. You define the target audience for each call to action. You identify your partners. You need to know the resources that you have for each call to action. Then you plan the activities that will feed into these call to action, that aim to meet those calls to action. You prepare your advocacy messages. What will you say to stakeholders? There's the overarching message that you want to come across, but then depending on the stakeholders, you have to adapt your message. You also have to think of how will you assess your advocacy strategy and activities. But you have to think ahead of time, not at the point of everything is done and then we assess, just to make sure that you're satisfied with your approach and the outcomes. You want to decide ahead of time how you're going to assess. This is good practice, but also it's good for sponsors that they know that if you already have decided on your assessment criteria, that means that you know where you're going. You're solid and your seriousness can't be questioned. And then step number 7, you do it all over again. You go back to your calls to action. Are these the right ones? Should we prioritize them in the same way that things are being shifted, when you vote, because things evolve? And then you update your stakeholder mapping and so forth. So how to use the report as an advocacy tool? Well, when it comes to care for SMA, for adults with SMA, the calls to action are sort of, they're not completely prioritized, but you've got the list of calls to action. And you can basically decide which ones you think has the most impact, or the ones that you feel is reachable. It's achievable with your means, with your partners, and so forth, and the organization to collaborate for. The stakeholder mapping, I think it's an interesting one as well, because when you look at best practices, you look at different descriptions in country reports of different stakeholders, then you realize, for example, the example of the ombudsman. I'm not even sure if it's something similar in France. Maybe there is. I'm based in the Paris area, but it would give me thinking like, oh, maybe I should check if such stakeholder exists. So looking at stakeholders mentioned in best practices is something that is useful to make sure you've got all the target audiences that you can think of and identify potential partners. Also, you can plan your advocacy activities. Again, looking at best practice sharing, this is also very useful. And prepare your advocacy messages based on the key insight, because you know where unmet needs are and what you want to achieve based on the call to action. So in the individual work group, but also in the individual work sessions and in the group sessions, we're not going to cover all the steps because we're constrained. We have a time constraint. But I will still go through each steps and then share the ones that we will work on at individual and group level. So the step 1, prioritize your calls to action. This is not included in the individual and the group session, but this is something you can work on for other issues. This is just a suggestion for illustration of how you can use it. So for example, let's taking the transition from pediatric to adult care. So this is the issue or indicator. You put it there. What is the call to action that you contribute, but you want other stakeholders to contribute to? The impact, obviously, this is something we discussed with Laura and Alice, is that it's a 4. Feasibility, we're thinking 1 because it's challenging. And then you sort of decide with this, you do with all the different indicators, the one you think, the composite value of maybe where we should, invest most of our effort at this point in time, but everything is always evolving. One thing also to take into consideration is other stakeholders. Are other stakeholders already working on similar issues? Like Marie-Christine mentioned, there is already Eurodis, ERN. They're leading some of that work. And it's important that, IFM Téléthon takes part to these discussions and be in the room. But IFM Téléthon is not going to lead something that's already in place. So understanding who's already working to figure where the organization positions itself. Are we the ones that are going to be leading and reaching out to other stakeholders, or joining and supporting an effort and contributing to? So you could do this as a table, and at the end you do a total and you realize, okay, possibly, we'll focus on multidisciplinary care before transition to pediatric to adult care services. This is just for illustrative purposes. And then you may decide still, like, despite the ranking, that you want to focus on one particular indicator because of issues or like resources. Another way of doing it, it's good when you're actually in the same room and you have a flip chart, but these are the same three indicators that I mentioned, the impact for patients, the feasibility, and other stakeholders. And you could do this visually. And the calls to action would be, with a larger surface, is to be prioritized. That's one way of doing it. And this is adapted from a piece of work from Melanoma Patient Europe Network. And you could add other criteria, either in a table or visually, depending on how you prefer to work. But it's a way also to help prioritize the calls to action. But this step we're not going through for this exercise, but this is more for you to use after this workshop. So stakeholder mapping, this you should have received in the deck that was sent to you yesterday. So the second step is stakeholder mapping. So you have a sense of which call to action you want to focus your effort on. And now it's just understanding who are the decision makers, who are the influencers, understand their interests. So decision makers that have the power, formal authority to make the policy change. The influencers are the ones that will put pressure on the decision makers to make what we consider the right choice or the right decision. This kind of chart is probably already familiar to a lot of you, but going back to that conversation about the report, the report is, it will need an update because it's not, it's imperfect, but that still, as I said, I think it's an ongoing work. It will be an ongoing update regardless of what, but this is always a good excuse for conversation and getting people's interest. So you want to raise the interest of people in the cause. And so looking at those two criteria, people with influence and people with interest, you have sort of four categories of stakeholders. So the ones that you should most focus your energy on would be the managed closely category, because they have a high influence, high interest. But the persuade are the ones that also probably need more work, actually, because they have high influence, low interest. These two are very, very important. You also want to inform the ones that have a high interest but low influence, because they will spread the information, they will raise the awareness. It is influence, but it doesn't have an impact directly on decision making. And then there is the low influence, low interest. These are the ones that you want to monitor, but don't waste your breath. It sounds a bit harsh, but patient organizations have limited amount of time and resources. So it's best to focus on those three buckets: the persuade, manage closely, and the inform. So this is obviously for illustrative purposes because it was put randomly, but at your own country level, a sense of who are the ones that have high power and where do they have their level of interest. So we put, for the sake of illustration, Ministry of Economy has a high influence, obviously, but what's their level of interest? We decided to put it at 3 out of 10. Medical societies, we put them, in the top, in the managed closely section. So this is the way to sort of think, spending 10 minutes on 5-10 minutes on this, just trying to think, who are the ones that are really key in your country? You could do it visually. The way I would do it, but maybe, I mean, these are suggestions. Obviously, it's not prescriptive. I start to sort of map them, just do it, just almost without thinking, like automatic sort of writing, plotting the ones that I can think of directly. And I put them in this list. And then potential partners. Are they already partners? Yes, no. If they're not, are they a potential partner? Are they really people that we can, or people, it could be individuals or organizations that we can partner with? What are their resources? I mean, it could be, is it a big organization, or if it doesn't have much staff, but maybe has a lot of funding? What are what are their expertise? What are they known for? What are they renowned for? Is it knowledge, data collection, evidence generation? What could be their action on what could be their activities? How could they contribute to make this call to action a reality? And are they already working on it? So when you do this, in that process actually makes you think of other stakeholders. Essentially, it always happens. And it makes you also shift sometimes what you had put initially. So, for example, here I left Ministry of Economy, but then Medical Societies was actually probably here, if I recall, and then it shifted there. And things could shift a little bit once you've done all of this, because you realize that from your initial perception to your actual desk research on their resources and what could they do, things kind of shift literally a little bit. Then this section, it's about identifying your resources first, to identify what we call the low-hanging fruits, because it could be something really important. This is the most impactful, and it's no other organizations are working on it, but it will require a lot of staff, a lot of volunteers, a lot of finances. And then you want to provide specifics. Excuse me. What does that mean? If it is important or average, what exactly does that require? Is it something you can really cope with? And then maybe, yes, yeah, oh, sorry, I meant the other round. You have a lot of resources. You have, you can do it. So you list exactly and you make sure it's true. But you feel you don't have availability. You don't have enough resources. It's low or unavailable. This is something you can dedicate any staff to. You don't have the finances. What potential ally or partners, stakeholders could do? So could they actually bring that? And when you reach out to them with a proposal, you have something structured, as in, we want to reach this objective, this call to action. We bring some knowledge, but if you could bring some finances and you bring some volunteers, so like which partners can bring what, and when you reach out to them, you have a tailored approach onto what you want to achieve, how they can contribute, and you know exactly how you want them, or you think you want them to contribute. And they may say, actually, no, we don't have volunteers, but we have money, So in that conversation, you can sort of align on what the resources would be needed for each call to action. It could be also like expertise, obviously, in communication, whether it's medical or press, knowledge of policymaking decisions, relations with decision makers, and influence. These are indicative, and you could add other criteria or decide that some criteria don't really apply to you. But this is in terms of assets and resources. These are indicative. It's a starter. So you know what your call to action is going to be. You've identified the stakeholders, you map them, you see which ones could be allies, potential partners based on their interests, on their influence, on their resources. And you identify your own resources. And now you're going to think, okay, what is it that I'm going to do my organization is going to do to contribute to this call to action? And there are like 4 kind of overall categories. Would be data collection, evidence generation. For example, this report. This is something that contributes to generate data and support advocacy. Materials and publication. So following the data collection and the evidence generation, the report again, but infographics, policy briefing, policy statement, white papers. Also organizing meetings and events with decision makers and or influencers, and it could be a wide variety of different events, such as patient panels, expert panels, conferences, institutional meetings. It could be one-to-one meetings with health authorities, member of parliaments, exhibitions, galas, networking receptions, award ceremonies, sport challenges. And then another category of actions will be media and communication. So open letters, opinion editorials in journals, features on the radio, on television, on social media, some interviews and articles. And not all of these have to be done, but these are different tools. And depending on your resources, if you've got people that are really strong on social media and your team is relatively small, you go with your strengths first and then partner with other stakeholders who are, for example, really good at data collection and publication to reach a particular goal, particular call to action. So here, it's sort of, it's nothing groundbreaking, but it's just easier for taking notes for this exercise. Maybe your organization, again, will be just about media and communication, and maybe another will be more about just doing meetings and events. There's no rule, and really choose what is the type of activities that correspond to the DNA of your organization as well. Then you prepare your advocacy message. So going back to, you've got your call to action, you identify the stakeholders, their resources, and then you have your resources. You identify what you can do, what they can do, and depending on what the typology of stakeholders, what is it you're going to do? And do you want to inform them, convince them, engage them? So are they the ones that have a high level of interest and a high level of influence, or are they the ones that have the same level of influence, but they don't have any interest? So then the ones that, you want to convince them, you want to convince the ones that have a low interest, but you want to keep engaging the ones that have a high interest and some decision-making power. So in terms of stakeholder category, this is going back to this map, with the 4 quadrants. Basically, you've got the champions or the opponents. Actually, it could be also opponents, some that have a high interest, but they're not, they want to, how would I say, they want to do some budget management, for example, and they're opponents, like let's say the Ministry of Economy. It could be an example, illustrative example. So these are the ones with a high influence, high interest. You want to manage them closely. The champions, you focus on the action they can take to contribute to your call to action. The opponents, the thing about opponents is that trying to change their mind is going to be really difficult directly. So you don't want to kind of spend too much time trying to always contradict them, but you want to go indirectly through champions who would have an influence on opponents. So this is sort of very sort of tactics and about it. So the example of stakeholders will be high-ranking health policymakers, influential healthcare, and financial officers. You've got the key players, so they have a high influence, low interest. You want to persuade them, as I said. So that's mid-level government officials, for example, regional health authorities, health insurance and influencers, like healthcare professionals, the media. Then you've got the supporters. You want to inform them, you want to share information on the issue. So these are patient group, families of patients, grassroots organizations, general public. And then you've got the observers, the ones that have low influence, low interest. You want to monitor. You monitor. When I say focus on those you can convince, I don't mean like these should be the ones. You should focus more on the supporters and the key players. But for them, for the observers, you want to conserve your limited resources. You don't focus on them. You focus on the ones you can convince, which are the supporters, the key players, and the champions that you want to keep satisfied. And here are examples of. I put consumer groups as an example, but I didn't put anything specific. So you prepare your advocacy message. So depending on the stakeholder category, the message will be slightly different. So it will differ from a champion to a key player to a supporter. So to a champion, obviously, I'm not saying we should do flattery, but it kind of helps when you say your leadership is crucial in driving funding initiatives. So just putting them as, and they are key decision-making players, but you want them to, they like to be reminded of their leadership. So crucial in funding initiatives that make SMA treatment centers accessible. Together, we can ensure necessary investments are secured, making a real difference in the lives of those affected by SMA. Obviously, this is a very simplified message because we have little time today, because this a message will be longer, more structured, and with more references, but as in for more data to support it. But this is sort of illustrative, simplified message to show the difference in terms of angle. Key players, rather than leadership is crucial, it's like your support is essential in advocating for increased funding. So the key players will be the ones that would influence opponents or further support champions in enhancing accessibility at SMA centers, improving quality of life for many. Your influence can shift budget priorities to support this vital cause. And then supporters, you have to stay informed and vocal about the need for accessible SMA treatment centers. Your voice is powerful in building momentum and influencing funding decisions. So let's work together to make accessibility a reality for all. Again, these messages are simplified. This is nothing refined, but it's just to give you a sense of, depending on the stakeholder, things have to be adjusted. And then you plan the assessment of your advocacy strategy and activity. And I've got 3 minutes left, so I'm going to wrap up. So you have to think of the output indicators. So meaning you list all the things in that table where you put all the activities. And then once you're sort of done, we think, have I done all the things that I said I would do? Has it been done also by the time I wanted them to do? And then over time, you want to see if it has any impact on the call to action and on adults living with SMA. So you agree on the outcome indicators as well. So it's about output and outcome. And then you update your strategy again. So this I've gone already at length. So individual work session, work package. So you received already a work package, but I've sort of expanded. I will leave this slide on the screen for you to look at and keep track of. So you have 45 minutes to prepare individually using the slides that you received. And you can use the information in the comparative report and your country report if available, because I understand some of you might connect from countries where there's no specific country report. But you also should use your own experience and knowledge. And to Lisbeth's point, when she said that the situation in Denmark is no longer exactly as it was for the indicator that we were discussing. For this exercise, you focus on your own country situation. Don't think about Europe. Just do not worry about how it can differ from other countries. So you've got 45 minutes. I put 10 minutes each for each sort of step. So it's about step 2, step 4, and step 5. The reason why we don't do the other steps, is because of time. But think of stakeholder mapping, and I would say don't overthink it. Really put the ones that are the most important ones and try to think of how influential they are and the resources. Then think of the advocacy activities, some that you're already conducting, but others that you could do. And try to think of what will be your advocacy message to one stakeholder. So one stakeholder that you choose from the mapping. If it is regional health authorities overall, or the Society of Neurologists in your country, one stakeholder, and you try to think of your advocacy message. What would you frame? What would you tell them with regard to the indicator you're going to work for? Then you send all your slides to Alice and Laura. Try to do as much as you can. If it doesn't have to be complete. The idea is really to get started thinking so that your work can fit into the work group. And so, for example, I'll show you again the slides to work from. So I'm taking the example of group 1. The instructions, and it's all the same. So whatever changes on the left-hand side in the green column. But it's just a reminder of the difference between decision makers and influencers. This is the stakeholder mapping, the list of stakeholders. I didn't put the mapping again for update because we don't, and how it would change because we don't have time. Then think of the activities that you could plan, the ones that you feel that make sense to you. And in between those steps, there was a notion of resources, but we don't have time to go through that process. Though it's useful to plan the activities, but skipping that step, think of the activities you can plan to meet this call to action. And then, so you list them. And then, as I said, you're crafting messages. Think of one stakeholder that you choose, keeping in mind of how is your message going to come across? Are you trying to persuade? Are you going to inform? Do you want to manage and engage? So manage closely is actually engaging, so it's going beyond persuading. And you choose one particular stakeholder for ease for the exercise. And I'll go back to the instruction slide, which are here. And I'll pause to see if there are any questions or doubts before you dive into your individual work session. I don't see questions. So we're almost good to go. We've lost some participants, but we gain new ones. So that compensates. I realized we didn't actually do a round of introduction, but that probably would have taken a lot of time. But the breakout sessions will be actually a good way to start with a round of introduction for in each group so that you know better each other. And that's it. So we're resuming our discussion and moving to the breakout session, so which is the extension of the exercise being done so far. So now each of you will be allocated to a different group. So there are 3 groups working on 3 different indicators and so 3 calls to action, different, one each. So the group has 40 minutes to share and discuss what each of you has been sort of preparing in the last 45 minutes. We realize country situations are very different and agreeing on a common approach will be challenging. So the goal of this exercise is trying to focus on any potential commonalities between countries regarding this call to action. If you can't find any, please explain, report back to the group when we go back in plenary and explain why it was really hard to have a European approach to Christine's point, certain actions should be really taken at European level, and others maybe cannot be done. So we could see that. Do as much as you can, flag the challenges you have faced. The point here is not to have anything, not to have a strategy that's perfect, but to really get into that sort of operating mode of putting insight into action in terms of strategy. Same steps, so stakeholder mapping, planning advocacy activities, and prepare your advocacy message to one stakeholder. So the issue is to find commonalities in terms of which are the stakeholders the most important. Think of plan activities that you can do collectively and choose one stakeholder that you think is really key, or a category rather than just one specific, but a category of stakeholder. And, prepare your, have some sort of summary slide with your key points. Alice, Laura, and Federica will be, helping you to support and taking the notes as well. And I'll be moving from one group to the other. So once those 40 minutes are passed, then we're all back in plenary, and you'll be able to, we'll prepare and discuss what you've come up with. I'll pause here to see if there are any questions, or if Alice or Laura wants to add something else. So in terms of next steps, as you know, each of the breakout sessions has been recorded, and the morning session has been recorded. I hope I'm not anticipating too much on what you wanted to say, Alice, but maybe you complement. But so the morning session has been recorded and will be made available by Alice and Laura. And for the afternoon session, the breakout session room have been recorded, and there will be a report. So key takeaways will be summarized. There'll be a summary report. So you'll have both the slide decks, the recording for the morning, and then a summary report of the breakout session. Have I forgotten something, Laura and Alice, on the deliverables?
No, I don't think so. So if anybody has not sent your individual work session slides yet, please do that so that we can make sure that we integrate as much as possible in the final report. Yeah, I think that's it. So, we will compile all the information and then share with you as soon as we have it, and the recording of all the sessions where Anne-Pierre explained things to us so thoroughly will be made public on the SMAcademy website and on Autisma, I think, as well. So you will hear from us. And also, I mean, this was, a first for a very long online workshop. So first of all, thank you all for bearing with us. We know it's long and it's difficult online, but sometimes, we try and we make do with what we have. So thank you. And you will get also a feedback form so we can hear your thoughts about, if this worked out for you or not. And Claire, did you have any final remarks before I say the thank yous and goodbyes?
I think final remark is that it will be more like end of April to get the reports, just to manage expectations. One reason being that is I'm going on holiday for 2 weeks. Tomorrow, the day after tomorrow, so I'm not going to be available during that time. So it's not for lack of interest or any of that. So certainly yes, it will be delivered to Alice and Laura, who are going to look at it, and then once it's good to go, it will be shared with you. So yeah, that it's we haven't forgotten about it, but it will be in the works. All right.
All right.
It's been a pleasure. And enjoy the rest of the day.
Yes, thank you, Anne-Pierre. So
thank you.
actually, I wanted to thank Anne-Pierre because this it was a very ambitious project for this workshop, and we tried to pack a lot of information in it, but we really hope that you got away with not only more knowledge about the benchmarking report, but also concrete ways that you can use it and think. And, we will share the slides with all these beautiful templates that Anne-Pierre shared that I hope are, tangible tools that you can really use as you think about things and how to address different stakeholders. So thank you, Anne-Pierre. It was really great, and I know that I learned a lot in the process. So I hope the same for everyone else. And I wanted to thank also Laura and Federica and Carolina for all the work they put and the time commitment they dedicated to this, as well as all of you for attending and being very active in the workshop in this a not too friendly format of online. I also am not a big fan, but it worked great. So thank you all, and we will see you at the next SMAcademy appointment for sure, I hope. That will be in May, date still TBD, but it will come very soon. And it will be a workshop led by our own Emilia, actually, about how to build an awareness campaign. So stay tuned, and I hope to see you there.
Thank you. Thank you for your attention. Thank you for sticking around.
Thanks a lot for
Bye-bye.
everyone.
Thank you very much.
Thank
you, everyone.
Bye-bye.
Bye.
Thank you.
Bye.
Bye.
Bye.